So in a radiology lab, you might want to ask reasons why they are very strict about rules in a radiology lab. Okay, and here we're here to now answer that question. Okay, why the strictness in a radiology lab? Why is it that there's strict adherence to standard procedures in a radiography lab? So the standard procedures, all of us, we know it. We've actually gone across them. We have gone across them, and we have seen that they are basically things that you should follow, to ensure your safety in a radiology lab. So what we got is radiology labs are healthcare environments, and this is where patients, staffs, and equipment, they all interact. Do you understand? So there's risks for injuries, there's risks for the spread of infections, and the rest of it. So first reason is infection control. So radiography labs handle patients with known or unknown infections. So the patient could have an infection that even at the hospital level, in the ward, they still haven't dictated that infection. Do you understand? So we just want to overall be careful with everybody. So standard precautions, hand hygiene, use of gloves, gowns, masks, all of that should be, should be done across the staffs, across the patients, everybody. Protection of healthcare workers. So radiographers are exposed to a lot of patients, so you don't want to come and pick a disease condition as a result of your work. All those hepatitis B, hepatitis C, HIV, this is just a few different disease conditions. Tuberculosis, a lot of it. Patient safety. So any patient that is coming in is always going to the same machine. So this patient touches it, this other patient comes and touches it. So you just want to ensure that there's a lot of safety around, strict cleaning and barrier precautions and all of that. Then for radiation safety integration, while infection control is the main focus, precautions also complement radiation safety protocols. So as you're wearing all those protective gowns, the gloves, the shields, you're just trying to, you want to also prevent contaminations to the equipment and the environment. So professional and legal responsibilities is radiography labs are bound by hospital principles, national guidelines, and international standards. So failure to follow precautions is just as if you are breaking rules that have already been set on ground. You understand? So it could lead to you losing your accreditation. So these are not things to optionally follow. They're actually rules by which anybody that operates a radiography lab should go by.